everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about chickenpox. So chickenpox is a highly contagious infection and it is caused by varicella zoster virus. Now, this virus, varicella zoster virus, causes two distinct clinical diseases. Those are varicella, that is called as chickenpox, and the other one is herpes zoster, which is known as shingles. So this is usually mild. This infection, this chickenpox, is usually mild, but it can be serious, and it typically affects 2 to 8 years old, but it can affect anyone. And it's a vaccine preventable disease. That means we have got vaccines to prevent this disease. So next, moving on to the meaning of chickenpox. Chickenpox, an ubiquitous and extremely contagious infection, is usually a benign illness of childhood characterized by an exanthematous vesicular rash. So as I mentioned earlier that it is highly contagious, so this can spread from person to person, and it is usually a benign illness of childhood, and it is characterized by an exanthematous vesicular rash. So you can understand that in this disease condition, you can see that the child will have rashes all over the body. And what are the other symptoms that we will learn in later slides. Now, next, let us learn a bit about the virus, that is varicella zoster virus. So as I mentioned earlier that this virus causes two distinct condition, that is, one is varicella, that is chickenpox, and the other one is shingles. So this varicella zoster virus is basically a double-stranded DNA virus, and it is a part of herpes virus family. So next, let us learn about the transmission of this virus. Right now, chickenpox is an airborne disease which can spread easily through the coughs or sneezes of an infected person. So if somebody is infected with chickenpox, or somebody is infected with this varicella zoster virus, then if they sneeze or they cough, this virus can easily transmit to other person. So I mentioned earlier that in this condition especially, you can see that the child will have rashes all over the body, right? So basically, the infection can start to spread from 1 or 2 days before the rash appears, until all the lesions have crusted over. So this is the period of time where this infection can transfer to other person also, or the infection can spread to other person. Now, apart from this coughing or sneezing, that is through the droplets, this can also spread through contact with the blisters. Right. So when we will learn about the signs and symptoms, we would get to know that how these blisters would form, and if somebody is in close contact with the infected person and they are they're having contact with this blisters, then again this infection can spread to other person. Well, so we learned that chickenpox is highly contagious infection, and it is caused by a virus which is from herpes virus family, which is varicella zoster virus. And this virus causes two conditions, that's chickenpox and shingles, right? So here we are talking about chickenpox. Now let us move on to the pathophysiology to understand how does it infect a person. Well, so when there is an infected person who is already infected with chickenpox with the varicella zoster virus, when they sneeze or cough, what happens? This viruses leaves the lungs and gets released into the air, right? So we learned that this can travel in the air. This can the mode of transmission is actually through the droplets. Right. So when this infected person would sneeze or cough, this viruses would leave the lungs and it would be released into the air. Now, apart from this, if there is contact with the oral mucosa or skin lesion of an infected person, then again through that also this infection or the virus might spread. Now, when the virus comes in contact with the respiratory mucosa of the new person, it starts replicating in the epithelial cells. So once it enters the enters into the new person system, it starts replicating itself, right? It starts replicating in the epithelial cells. Now once they have increased in numbers, it soon it would get picked up by the nearby immune cells, and it would get transported to a nearby lymph node. So here the virus is already reached to the lymph nodes, and now the virus causes primary infection, which is called as varicella or chickenpox. Now this varicella or chickenpox has two stages, right? So the first stage is primary viremia and the second stage is called as secondary viremia. So first we would learn about primary viremia. So in primary viremia, what happens? The virus infects a part of immune system in the liver and spleen, which is called as reticuloendothelial system. And this reticuloendothelial system is made up of phagocytic cells. So this you have to remember that in primary viremia, the virus is attacking or infecting the part of the immune system in liver and in spleen, which is called as reticuloendothelial system. And this reticuloendothelial system is actually made up of phagocytic cells. So about 2 weeks after this infection, the virus would start infecting our immune cells, right? And it would invade our WBCs. And then the virus would start infecting the helper T cells, right? And when the virus infects the helper T cells, that is considered as secondary viremia. So basically, the varicella or chickenpox has two stages, right? One is primary viremia and the second one is secondary viremia. In primary viremia, what is happening? The virus is infecting a part of the immune system in our liver and spleen, which is called as reticuloendothelial system. And here you have to remember that this reticuloendothelial system is actually made up of phagocytic cells. And this is what is happening in primary viremia. Now, next thing what is happening, this, soon after this initial infection, this virus would start to infect our immune cells. It would start to invade our WBCs, and then the virus would start infecting our helper T cells. So once the virus starts infecting our helper T cells, that is considered as secondary viremia. Now this helper T cells would move around, right? So once the T cells would reach the skin, they would release these viruses. And now the infection would spread through the skin, and it would move from one cell to another. So here, what is happening? The virus is getting released in the skin, right? So once the helper T cells is would reach the skin, it would release the virus, and then the virus would spread through the skin. It would move from one cell to another, and this would result in lesions on the skin. So this is how the infection progresses. This is how, the varicella zoster virus actually infects a person. Now, next let us move on to the symptoms. So what are the symptoms that, we can see in a child who is infected with chickenpox, right? So we have already mentioned that there would be rashes all over the body, and there would be blisters also, right? So these are the two terms that we came across in our previous slides. Now here we would see, apart from those, what are the symptoms that we can see? So initial symptoms are 1 to 2 days of fever. So there would be fever, as there's infection in the body. Next, there would be malaise, there would be headache, and the child will feel an overall weakness. And now, after 1 or 2 days of this initial, symptoms, the rashes would start to appear, the skin lesions would start to appear, and this skin lesions would appear all over the body. It would appear on the scalp, face, and trunk. It can even comes inside the mouth also. So it can also be present in the oral mucosa. Now, in the initial days, when this lesions would appear, this would look flat, red, and like an itchy spots. This would be, there would be itching, and these are called as macules. Over time, they would become elevated, which is known as papules. And eventually, these papules would form small fluid filled vesicles. Right. So this is how the rashes would appear. This is how these lesions would appear. And within 1 to 2 days, the vesicles begin to crust over and form scabs. So, this throughout the infection, these lesions would start to appear, right? So you can see, the lesions would be a different phase. Some lesions would, appear, which would be which would be macules. Some would be, fluid-filled vesicles, or some would be papules. Right. So throughout this infection process, these, the lesions would appear on various parts of the body. Confirm the diagnosis, we don't need much of investigations, because these skin lesions are very much, it's a unique feature, and this pretty much suggests that it's a case of chickenpox. So the diagnosis is made based on the signs and symptoms, and also the way the skin lesions appear. Next, moving on to the treatment of chickenpox. So in treatment, we can give topical antipruritic medications, because the lesions would be really painful. It would be itchy. So to manage that, we can give topical antipruritic medications, and also along with that, we can give analgesics and anti-inflammatory medications. And for children who are less than 12 years of age, for them acyclovir is recommended. So if we are giving acyclovir, we have to give 20 mg per kg every 6 hours. Well, so this is how we can manage chickenpox with medical treatment. Next is prevention. So how we can prevent this disease? Now, at the starting itself, we mentioned that it is a vaccine preventable disease, right? So we have got vaccine to prevent this disease, that is varicella vaccine. So this vaccine is given to the children to prevent the occurrence of chickenpox. Next, moving on to the complications of chickenpox. So the most common complication of chickenpox is secondary bacterial infection. So if there is secondary bacterial infection to the liver, there would be hepatitis. Also, if it affects the lungs, there could be pneumonia. And if it affects the brain or the meninges, then there could be encephalomeningitis. And another complication of chickenpox is Ray's syndrome, where we can see that there will be swelling of liver and brain. Now, this is a very rare complication, but it can occur if it is, if the condition is not treated properly. And so if we talk about the complication, the most common complications are that there would be secondary bacterial infection, and because of that there would be hepatitis, pneumonia, and encephalomeningitis. Well, so next let us move on to the nursing management. So in nursing management, first we would talk about nursing assessment. So as a nurse, what are the assessment that you would perform? So the first one would be history taking. Now in history taking, it's very important to collect the history, that if there is recent outbreak of chickenpox in the community area, or if the child is going to school, there also, if one child is infected and they're not aware and they come to school, then this infection can spread to others, because we would get to know about it once the rashes starts to appear, right? And we know that the infection can spread even before the it starts before 2 days of when the rash appears, right? So we have to collect the history if there is recent outbreaks in the community, or in school or daycare, or among family members. Next, you should also assess that if the child has already received the varicella vaccine, or if the child is immunosuppressed, if there is any other condition which is because of that, if the child is immunocompromised, then again there is the child will be at more risk So as a nurse, you have to, first thing that you should know that if there is any risk factors. So if if the child is immunocompromised, that would tell you that child is more vulnerable to this infection. And if you find out that the child is immunocompromised and there is recent outbreak of chickenpox in the community or in the family, then you have to make sure that you make the parents understand that what are the precautions they should take, and how they can prevent chickenpox for these children. Well, next let us move on to the nursing diagnosis. So, what are the nursing diagnoses would be there for chickenpox in children? So, firstly, we would think about the signs and symptoms, right? And in signs and symptoms, we learned that in the initial days, there would be fever, right? 1 to 2 days of high-grade fever will be there. So, definitely there would be fever related to viral infection. And then we also learned that there would be blisters, there would be these macules and fluid filled vesicles all over the body, right? So that would that is present on the skin, right? So definitely that would impair the skin integrity of the child. So definitely one more nursing diagnosis would be impaired skin integrity related to mechanical factors. Example, the tear or the presence of blisters on the skin. Next, there will be disturbed body image related to lesions on the skin. So as I told you that there would be these lesions all over the body, and there won't be that 1 or 2 lesions here and there. It's not like that. There would be many lesions all over the body. So that would also cause disturbed body image. And also sometimes for children, there would be deficient knowledge about the condition and treatment needs, because they're not at a level of a level where they can understand that what kind of disease it is, and sometimes they would feel stressed by looking at the lesion, right? Next is risk for infection related to damaged skin tissues. So we know that there is impaired skin integrity, there are lesions in the on the skin, right? So if there is breakage of these lesions, and I also mentioned that these lesions are very much itchy and it is painful, right? So there is always is a chance that they might scratch the blisters, and because of that there might be breakage on the skin, right? So again, there is a risk for infection due to this damaged skin tissue. Well, next let us move on to the nursing interventions. So what are the nursing interventions that we can take up when we are taking care of a child with chickenpox, right? So firstly, we have to make sure that we increase the fluid intake in the child, right? So there is infection in the body, there are blisters present on the body. So definitely there is a chance that there would be dehydration. The child, there is impaired skin integrity. So to manage all these things, so we have to make sure that there is increased fluid intake. And also we have to make sure that there is, the child is taking enough rest. So we have to encourage them for taking rest. We also, as a nurse, it's our responsibility to make the parents understand that, how important it is for the child to take rest at this period. Now, next, we also have to avoid aspirin containing products to prevent Ray's syndrome. So we already learned what is Ray's syndrome. There would be swelling of liver and brain. This is extremely rare condition, but this can occur as a complication. And most of the time, if there is, usage of aspirin containing products, then again, the risk is more. So we have to, educate the parents, and we also have to make sure that we're not giving any sort of products which has aspirin in it, and especially for children who are below 18 years old. Next, we also know that the child will have itchy and painful, blisters, right? So we can apply calamine lotion or any other topical ointments to alleviate the itching. And also we have to advise the parents not to give hot bath to the child. We can give cool bath to the child but not hot bath. Why? Because hot bath will increase histamine release, and if there is increased histamine release, that will increase the itching. So we already know that the child is already having itching, and we don't want the child to scratch the blisters, because that would again increase the chance of secondary bacterial infection, right? So we have to prevent all these things, and for that we have to make sure that we are not giving hot bath to the child. And then we have to avoid scratching to minimize the risk for secondary bacterial infection. So as we know that these lesions would be extremely itchy, the child might scratch these lesions, and if there is breakage in these lesions, then definitely there would be that would increase the risk of secondary bacterial infection. So to minimize that, we have to make sure that we avoid this scratching. We also have to make sure that the parents understand how important it is to avoid scratching. Well, we know that how this infection spreads, right? So when the infected person sneezes or coughs, this the virus comes out from the lungs, and it enters the healthy person, right? So we know that this virus can travel into the air, right? So we have to isolate the affected individual, because then there would be risk that other family members would also start getting affected, right? So first thing we have to do, we have to isolate the affected individuals, and then we have to take airborne precautions also. So as a nurse, even if the child is in the hospital, or even if the child is at home, in both the cases we have to make sure that we are taking airborne precautions. So if the child is in hospital and you're going to take care of the child, you have to make sure that you follow all the aseptic techniques. You wear proper gown, mask, and gloves, so that the spread of the infection stops. Now, to avoid scratching, we can also trim the fingernails of the child. And if it is, in case if the child is very small, in that case we cannot make the child understand, right? Make the baby understand that they should not scratch it, right? So in that case we can trim the fingernails, and we can make the baby wear mittens while sleeping, so we can avoid scratching. Next, we also have to advise the parents to provide, proper diet to the child. There should not be any restriction in the diet, and the child should get unrestricted diet and a full diet which is required, right? So most of the time the child will have lack of appetite when the child is having this varicella zoster infection. Most of the time we can see that there would be lack of appetite. So we have to encourage the child to eat properly, to have a proper food, and we also have to make sure that they are taking enough amount of fluid and they're maintaining their hydration. Alright, so that's all about today's class. Now let us conclude our today's topic here. So today we learned about chickenpox, which is caused by varicella zoster virus, and this virus causes two different conditions, that is one is varicella, that is chickenpox, and the other one is shingles, right? So here we talked about only chickenpox, where we learned that how it transmits from person to person, right? What the mode of infection, and what is the pathophysiology, how does it infect a person, and then we also learned that how it can be managed, right? So I hope you have got a better insight about the topic. Thank you.